Why does zinc deficiency cause decreased sense of smell and decreased taste sensation? There are two kinds of vignettes on the USMLE for regarding zinc deficiency that I want you to remember, and I will try to simplify both of these vignettes for you so that you never lose scores regarding zinc deficiency on the USMLE. So first vignette is that there would be a scenario about a patient where there will be a mention of decreased sense of smell and decreased taste sensation, and then the various minerals will be listed. You should remember that it's just due to zinc deficiency. Zinc deficiency causes decreased sense of smell, that's anosmia, and decreased taste sensation, that's hypogeusia. But why it happens actually the precise and simple answer is that zinc acts as a cofactor for various types of cell turnovers, and that also includes olfactory neurons and the taste buds. But if you want to know more details, then there's a protein called gustin, which is also known as carbonic anhydrase 6, which helps nourish various taste buds, which usually turn over every 10 to 14 days. But I want you to remember that USMLE is not concerned about these details. What is important is that zinc is required as a cofactor for various types of cell turnovers. So obviously when there's zinc deficiency, cell turnover doesn't happen properly, and that obviously leads to the decreased sense of smell, anosmia, and decreased taste sensation, hypogeusia. Second vignette on the USMLE regarding zinc deficiency, that there would be no mention of decreased sense of smell or decreased taste sensation, but there would be a mention that a patient has rash, diarrhea, and alopecia, and obviously different minerals would be listed in the answers, and you need to choose the zinc. Zinc deficiency actually causes all three of these symptoms. Now the answer is obviously the same, because zinc is required for cell turnover. When there is not proper keratinocyte turnover in the skin as it is supposed to occur, obviously it would lead to scaly skin and rash. Similarly, in the GI tract, when there is not proper GI cell turnover, it leads to gastrointestinal disruptions and subsequent diarrhea. And there's a fancy, sometimes there's a mention of this fancy word in the scenario. That patient has acrodermatitis, acro for the hands and feet. But I want you to memorize that this condition, acrodermatitis, is just because of abnormal cell turnover in the skin. It's rash. It's because of zinc deficiency. Actually, it's related to a congenital nutritional deficiency known as acrodermatitis enteropathica, which presents in the neonates which have problems with zinc, gastrointestinal zinc absorption, and therefore those neonates, those children usually present with rash, diarrhea, and alopecia. And that's because of improper, obviously, or decreased gastrointestinal zinc absorption. That's it. These two kinds of vignettes usually are on the USMLE regarding zinc deficiency. You just need to memorize these two vignettes.